know it, right? Cardiac output is mean arterial pressure divided by total peripheral resistance. And if we reorganize that equation, mean arterial pressure is dependent on our total peripheral resistance, right? So the dependable variable in the body is mean arterial pressure, and the manipulated variable, the one that we can play around with by playing around with the radius, is the total peripheral resistance, okay? So depending on the radius of the arterioles, we can then determine the total peripheral resistance, and we can therefore determine the pressure. So in terms of the extrinsic mechanisms, the sympathetic activity, as well as a few hormones that we'll mention, can affect the radius, can affect the state of the smooth muscle of our arterioles as well. When we talk about the sympathetic control, we know that that's basically going to vasoconstrict. Okay, we mentioned the presence of alpha receptors, which are part of what branch of the nervous system? What branch of the nervous system has alpha receptors? Yep, so the sympathetic of the autonomic, right? So the autonomic division, which has the sympathetic, and basically smooth muscle arterioles have quite a lot of alpha receptors. And we know alpha receptors are a class of adrenergic receptors, which simply means that they can bind norepinephrine or epinephrine in varying affinities. So norepinephrine binds to alpha adrenergic receptors, and this brings about vasoconstriction, which increases our total peripheral resistance. And as we mentioned on the previous slide, that will increase our mean arterial pressure. So increasing our resistance does what to the radius? Make sure you keep connecting the radius to the resistance. If I increase my TPR, what's happening to the radius? Sorry? It's decreasing, right? So if I'm increasing my TPR, I'm decreasing the radius, which is increasing the pressure, okay? So basically we have the presence specifically on our skeletal muscles and cardiac muscle, we have both alpha and beta receptors. On most of our other tissues in terms of the vessel here. So don't get confused with these tissues. We're not really speaking about skeletal and cardiac muscle here. We're talking about the arterioles that go to skeletal and cardiac muscle. Make sure you make that distinction. We know that skeletal muscle doesn't even have adrenergic receptors. So not the actual tissue, but the arterioles that are going specifically to these tissues. So on these arterioles, we have both alpha and beta adrenergic receptors, whereas on most of our other non-cardiac, non-skeletal tissues, in terms of the arterioles, we have alpha receptors. Now, norepinephrine will bind alpha receptors. That's going to cause vasoconstriction, but epinephrine can bind both of these, and it's going to do something different when it binds each. When it binds alpha, when it binds to an alpha receptor, it's going to cause vasoconstriction. When it binds to a beta receptor, it's going to cause vasodilation. But we know that epinephrine has a higher affinity for beta-2 receptors. Okay? Now, what this means is that there's a dosage-dependent relationship here. So in low concentrations, epinephrine would bind only beta-2 receptors. Okay? That's going to bring about vasodilation. But in higher concentrations, epinephrine will bind both of these receptors, and that will bring about vasodilation only in skeletal and cardiac muscles and vasoconstriction everywhere else. Okay, I'll say that again. So in low concentrations, epinephrine binds only beta-2 receptors, and that causes vasodilation. Whereas in higher concentrations, epinephrine can bind both of these. If it binds to an alpha receptor, it's going to cause vasoconstriction. And if it binds to a beta receptor, it's going to cause vasodilation. Sure. So what does that mean? Let's talk about that relationship quickly. What does that mean? So why would I want to vasodilate specifically to my muscles and heart and vasoconstrict everywhere else? What's sort of the benefit of doing that? Yeah, exactly. So that's going to tie back to that fight or flight example we used earlier. Okay, so it's going to maximize the flow to those specific organ systems, the heart and the skeletal muscles, but we still need to decrease flow everywhere else. So as we vasodilate arterioles that are going to heart and to muscle, we vasoconstrict arterioles that are going everywhere else. Okay.